Over 700 people have now died of swine flu in the first 49 days of this year and prompted the Cabinet Secretary to chair a meeting of health officials from 17 states to take stock. Experts say it's largely lack of awareness about the virus which has led to late detection and late treatment that's resulted in the large number of deaths. In West Bengal today, the Chief Minister, who's also the Health Minister, made a howler when she said mosquitoes cause swine flu, a statement that's likely to alarm experts who say not enough is being done to raise awareness.
এগুলো অনেক সময় মশার কামড়ে হয় নানা রকম তার আছে তো আমরা রোগ প্রতিরোধ তো আমার পক্ষে করা সম্ভব নয় কিন্তু রোগটাকে প্রতিষেধক ভাবে চিকিৎসা করার ক্ষেত্রে যতটুকু সম্ভব এটা আমাদের মানবিক কর্তব্য এটা আমাদের সামাজিক কর্তব্য সবারই কর্তব্য সবাইকে বলবো সাবধানে থাকবেন ভালো থাকবেন টেনশন করার কোনো কারণ নেই
NDTV's Rohit Maan spent 24 hours at Ahmedabad's largest swine flu OPD, where over 400 patients are being treated currently. With 120 new cases in just the last 24 hours, doctors are working around the clock, placing themselves at risk too.
Leading from the front, Dr. Rajesh Solanki, head of Department of Pulmonary Medicine at Ahmedabad Civil Hospital. He's heading the specially created swine flu OPD with a team of doctors and paramedics to battle the surge. Ahmedabad has witnessed 129 fresh cases in the last 24 hours alone, making the overworked medical staff at risk themselves. This is the OPD of the swine flu OPD at the Ahmedabad Civil Hospital, where doctors are working overtime to cater to the large number of patients. In fact, some of them have even been affected by swine flu themselves, but despite those odds, they are they're carrying out this relentless checking of patients. Doctors maintain enough safeguards are in place, but the increased cases have meant putting in work, often without a break. The team of 150 doctors are handling swine flu cases at the hospital, half of them deployed at the round-the-clock swine flu OPD that caters to about 400 patients daily.
Because at present, out of whatever number of swabs we have signed on OPD base outdoor, 50% are found to be a positive. So definitely it will create a good awareness and proper treatment. And for that we have enough manpower who are working 24 hours around the clock.
In the last few days, Ahmedabad has emerged as an epicenter of the surge in Gujarat. Of the 255 cases, 129 alone have been reported from Ahmedabad in the last 24 hours. 4 of the 12 deaths in the last 24 hours were in Ahmedabad. And overall, over 50% of the total cases in the state in the last 1 week have been from here. Doctors say one of the biggest causes of the rising fatalities is late reporting and detection. In fact, doctors have been urging the public to undertake swine flu tests at the first sign of a cough or cold, saying the flu can be managed in the first few days if caught in time and hasn't traveled beyond the upper respiratory tract. Door-to-door surveys were initiated a week ago, and the OPDs catering to the swine flu cases were started only about 10 days ago. Making matters worse, the government is still unable to strictly enforce the reservation of 10% of the beds in private hospitals for swine flu patients, urging people to take simple precautions like wearing masks and covering your mouth while coughing, for example. The government can only hope that the new OPD ward and specific steps it's taking to detect will help the situation, and that the cases will begin to fall once the weather warms up. In Ahmedabad, with camera person Network Parmar, Rohit Maan for NDTV.